Greetings from San Diego, California. This interactive multinational teleconference is reaching you live in English and Spanish through a unique and complex international telecommunications network via satellite, microwave, and cable. This program brings together distinguished institutions representing education, business, and government in more than a dozen countries in the Americas and Europe. We look forward to hearing from you all. This program, the third International Training Center video conference of the year 2004 series, entitled Success with World-Class Competencies, has been co-produced by the California Distance Learning Health Network, and we would like to welcome their network of sites. I'm Dr. Farhad Saba, Professor of Educational Technology at San Diego State University, and the moderator of today's program. The diverse society of the Third Millennium is faced with growing social, economic, and political risks and increasingly more easily spread global diseases that will continue to challenge the productivity and well-being of individuals, organizations, communities, and nations. Advances in medical research and practice have been significant in recent years. However, similar advances have not been made in developing effective healthcare management and communication systems suitable for high-risk environments, such as the ones we increasingly face today. Violence, terrorism, including bioterrorism, and antisocial behavior in general have become almost inherent elements of our global environment. The productivity and performance of our organizations cannot advance without preventative and corrective action, integrated health risk management, and effective distance and network collaboration between healthcare providers and patients are essential strategies for organizations to be able to ensure redundancy and continuity of services during emergency and crisis situations. Managerial innovation supported by information technology is greatly needed in many public and private healthcare delivery organizations. This program will discuss the growing urgency of this approach towards achieving performance, excellence, and disease prevention. Business, educational institutions, and government entities must develop technology-supported communication programs that continuously engage managers, workers, and patients in disease prevention and healthcare enhancement. The distinguished invited speakers will propose strategies and protocols to this end. In Module 1 of this program, Dr. Peter Andersen will describe one of the major paradoxes of our time. While general health has improved and led to increased life expectancy, we are facing a number of deadly diseases that are threatening the well-being of not only individuals, but organizations in which they are employed. Dr. Andersen then will present a number of preventative measures that employers can take to decrease health risk factors of their workforce. In Module 2, Dr. Andersen will conduct an interview with two distinguished colleagues, Dr. F. Ramsey Asfer, a medical doctor and senior fellow in the Division of Infectious Diseases at the University of California, San Diego, and Ms. Lydia Drumright, who specializes in infectious disease epidemiology and research. The interview will further delve into the issue of infectious diseases, how individuals can protect themselves against such threats, as well as those caused by bioterrorism and other risk factors. Professor Peter Andersen of the School of Communication at San Diego State University is a well-known author and has received recognition as one of the 100 most published scholars in the history of the field of communication. He is co-investigator or consultant on 2 tobacco prevention grants from the National Cancer Institute, 2 sun safety grants from the National Cancer Institute, and 3 grants from the U.S. Office of Homeland Security and the County of San Diego. And he is currently co-chair of San Diego County's Regional Network on Homeland Security. Dr. Andersen has managed numerous political campaigns and has consulted for school districts, law firms, child care centers, health organizations, universities, and business organizations. He has served as the president of the Western Communication Association, director of research for Japan-U.S. Telecommunications Research Institute, and editor of the Western Journal of Communication. Dr. Andersen is the author of 4 recent books: The Handbook of Communication and Emotion, Nonverbal Communication, Forms and Functions, Close Encounters, Communicating in Relationships, and The Complete Idiot Guides to Understanding Body Language. Dr. Andersen holds a bachelor's degree in political science from the University of Illinois, Chicago, a master's degree in communication from Illinois State University, and a Ph.D. from Florida State University in communication. Lydia Drumright specializes in infectious disease epidemiology and is currently the project manager of a behavioral research study involving people who have been recently infected with HIV. Her recent research in molecular biology focuses on viruses utilize their host's cellular machinery to produce and on the analysis of the genes related to mental disorders. Ms. Drumright also worked in communicable disease outbreak and control at the Los Angeles County Department of Health Services, specializing in analyzing hepatitis A infection. Ms. Drumright has extensive teaching history in topics such as statistical analysis, epidemiology, and infectious diseases. Most recently, her teaching and research has focused on HIV and sexuality-transmitted diseases. Recently, Ms. Drumright received a grant to study differences in risk between those recently infected with HIV and those at high risk of contracting HIV but who are not currently uninfected. She has given many talks and recently published a paper on partnership dynamics and STD transmission. Ms. Drumright holds a Bachelor of Science degree in biochemistry and cellular biology from the University of California, San Diego, a Master of Public Health degree in community health education from California State University, Northridge, and is currently completing her doctorate in epidemiology and at UCSD School of Medicine and San Diego State University Graduate School of Public Health. Dr. Asper is currently a senior fellow in the Division of Infectious Diseases of the Department of Medicine at the University of California, San Diego. He has a broad interest in infectious diseases and a focus on HIV. In addition to consulting in infectious diseases at UCSD, he has been working in clinical research related to HIV infection. He was the site principal investigator for a phase 1 study of a novel agent to treat HIV and integrase inhibitor. He has also worked on projects in sub-Saharan Africa in the area of international infectious control treatment of HIV and its complications and research in infectious diseases. In addition to his primary focus, Dr. Asper has a special interest in bioterrorism. In case of a bioterrorism event, as an infectious disease physician, he will be one of the principal responders. Dr. Asper is a graduate of New York Medical College. He attended residency in internal medicine in San Francisco. Master Rick Strobridge is a leading expert in telemedicine, advanced operating room design, and medical technology integration. He specializes in the improvement of healthcare delivery through the use of integrated telecommunications and multimedia technology. Mr. Strobridge is currently president and CEO of Healthcare Technology Corporation. Healthcare technology integrates hospital communications systems and is pioneering ways to allow all types of clinicians to communicate and collaborate more effectively. Mr. Strobridge is a pioneer in voice, video, and data networking, video conferencing, and distance learning. He implemented some of the first video networks for the U.S. federal government and the Department of Defense. His career includes many firsts in video networking field, including the first high-speed multi-point still image delivery system, the first VSAT satellite-based video conferencing system, and the first compressed motion video arraignment system. Mr. Strobridge was also responsible for the first video conferencing system installed in the U.S. Capitol. Mr. Strobridge's career includes 10 years at 7 billion system integrator SAIC, where he founded SAIC's telecommunication systems operation in 1991. Mr. Strobridge founded Teleimages Incorporated, a video conferencing system integration company. Teleimages has a wide variety of customers, including Hewlett-Packard, the U.S. Navy, California State University, and Bank of America. Teleimages was acquired by a Denver firm in 1997. In 1997, Mr. Strobridge co-founded Infomedics Communications Corporation to address the growing need for more efficient and comprehensive multimedia communications in operating rooms. Infomedics was acquired by Stryker Corporation in 1999. Stryker is a Fortune 500 medical products manufacturer with $3 billion in annual sales and operations in 170 countries. Mr. Strobridge is a graduate of Colgate University in New York and is listed in Who's Who in California and Who's Who of American Business Leaders. He is a member of the International Teleconferencing Association and the United States Distance Learning Association. Thank you and welcome to all. We begin with a question. The Spanish flu killed more than 30 million people worldwide in 1918 and 1919, and the average life expectancy has increased since then, 30 or more years. Today's healthcare is a bargain when one considers the benefits it brings, but how well are individuals and productive organizations really able to afford it today? Anyone who would like to answer that question?
Well, the medical expenses, of course, are escalating very rapidly, and that creates a dilemma for business. However, many businesses discover that it's really cost-effective to have a more healthy and fit workforce that decreases absenteeism, increases life expectancy, and probably increases worker productivity on the job.
Absolutely.
Absolutely. I would also like to say that even though people are living longer, we should also look at quality of life. And one thing that we've seen a lot more of, and I'm not sure if it's because we can detect it, because people see physicians more often, but that people are living uncomfortable lives medically.
I agree with that. I think that the advances in medical science have really taken us a long way, and with that comes a certain cost that people seem to be really willing to pay to some degree, but the costs keep escalating, so that's another factor to consider. As with the Spanish flu epidemic, there was very little cost or money from society going into healthcare.
Yeah, and of course, patients are much better educated today thanks to the internet and other communications technologies, and they'll go in and they'll pressure their clinicians to provide them with information and services that they otherwise would not have known about.
And no patient wants to forego the state-of-the-art, even
Absolutely.
though it might involve extremely costly medical technology.
Right.
Thank you. Let's begin with Module 1 of our program.
Today, in the third millennium, the state of human health has improved rapidly. Compared to 100 years ago, people live longer, healthier, and arguably happier lives. 100 years ago, the average life expectancy in North and South America barely topped 50 years. And in many of the poor countries of the world, life expectancy was only 40 years of age. Today, life expectancy is over 75 years of age in the United States and Canada, and over 65 years of age in virtually every country in North and South America. The discovery and use of antibiotics, the development of safer workplaces, the implementation of mass vaccination programs, and increased access to medical care and health prevention campaigns have resulted in longer and healthier lives for most people in the Western Hemisphere. Vaccination alone has been so successful that diseases like smallpox and polio have virtually been eradicated. Still, the challenges are many. Throughout the Americas, universal health care is rarely available, leaving many citizens without adequate care. Overuse of antibiotics has made many old diseases drug-resistant. Overcrowding and poor sanitation in many parts of most countries also presents a threat to human health. Unfortunately, in recent decades, human societies are faced with new diseases such as SARS, West Nile virus, Ebola, dengue fever, and the deadly HIV/AIDS virus, which continues to challenge and perplex the medical community. And the threat of bioterrorism may present brand new menaces and introduce old diseases that most of us thought were wiped out. Disease is not only a personal and a family tragedy, it is a significant problem for business. Studies show that sickness and related absences can reduce overall organizational productivity by 5% or more, resulting in the loss of billions of dollars in every country. Even minor diseases like colds and the flu can cut productivity and represent huge costs to businesses. Major illnesses like heart disease and cancer can result in huge amounts of lost work time and the total loss of key workers. Sadly, most disease is preventable, and employers can make a huge difference in preventing disease, absenteeism, and lost productivity. Infectious diseases can be prevented, and employers can make differences in many ways, including having a strict hand-washing policy, sending infectious workers at home or having them stay home if they're sick. Such policies can dramatically reduce contagiousness. Educating workers on communicable diseases can likewise reduce illness. Encouraging flu shots to not only prevent flu, but to bolster the immune system also is a great aid. The world's greatest killer is heart disease. Here, too, a health communication campaign by employers can dramatically reduce the incidence of debilitating heart attacks and early death. The second leading killer is cancer. Cancer is not a random disease, and a healthy workplace can reduce the risks of contracting cancer through lifestyle and other changes. So what can our organizations do to provide and promote a healthier workplace? First, our organizations can institute smoking policies. Smoking is the leading cause of preventable death in the world, and smoking is much more widespread in developing countries than in developed ones, particularly among the young and among working-age adults. Smoking is the source of more than just lung cancer. Many other types of cancers are associated with cigarette smoking. Worse, tobacco is a leading cause of heart disease and stroke. Businesses can do much to prevent the death, suffering, and lost work time associated with tobacco. All workplaces should have smoke-free areas. Studies show that having smoke-free workplaces helps smokers quit. Moreover, secondhand smoke is the third leading cause of preventable death in the world. The risk is largely eliminated in our organizations by establishing smoke-free workplaces. Smoking cessation programs are also excellent investments for an organization that will, as a result, reap dividends through healthier employees and lower health insurance costs. Smoking is highly addictive, so most smokers will need help in quitting. Likewise, many individuals can't immediately quit, so establishing outdoor smoking areas away from building ventilation systems is necessary and humane. Emphasizing the importance of limiting one's exposure to the sun is also important. While nearly everyone likes a sunny day, excess exposure to sun is a major risk to human health. In most countries, skin cancer is more common than all other forms of cancer combined. Ultraviolet rays from the sun cause up to 90% of skin cancers. We now know what we wish we knew when we were children, that excessive exposure to the sun is deadly. The most dangerous form of skin cancer, melanoma, is as fatal a disease as lung cancer or breast cancer. And basal cell carcinoma, which afflicts 1 in 5 persons, is associated with increases in other kinds of cancer. Sadly, skin cancer is preventable. The first line of defense is shade. Employees should avoid excess exposure to the sun, particularly at midday or in summer when the rays are strongest. Employers should provide canopies and shade for outdoor workers. Workers should wear hats and protective clothing, sunglasses, and sunscreen when exposed to the sun. The most dangerous behaviors are tanning until the skin is dark and getting sunburns. Such behavior can be avoided. If you're outdoors a lot, a light tan may be inevitable, but dark tans are indicative of really severe skin damage and are associated with skin cancer. While blue-eyed, light-skinned people are most vulnerable, do not be complacent if you have dark skin. Remember, Bob Marley died of melanoma. Dark-skinned people believe that they are completely protected from ultraviolet radiation. This is untrue. One recent study suggests that complacency about sun protection among dark-skinned people has caused skin cancer rates among those in this group to reach the same level as for light-skinned people, who may take more precautions. Organizations can also attempt to improve the health of employees through the promotion of proper dietary habits. Key to this is providing healthy foods, including plenty of fruits and vegetables and lean meats, avoiding sugar-laden foods and foods with a high fat content is optimal for good health. Having good nutritional habits helps make employees more productive and energetic, helps reduce absenteeism, and is useful in the prevention of premature death and disability. Good food habits can help prevent heart attacks, diabetes, stroke, and cancer, to mention a few maladies. Workplace cafeterias should feature and promote tasty, healthy foods and phase out fried foods and high-calorie sweets. Another area that is key in promoting organizational productivity and health is exercise. Our ancestors lived active lives, hunting, gathering, farming, and laboring with their bodies. Today, most workers sit in offices, factories, classrooms, and boardrooms, and get little or no exercise. Encouraging exercise programs for sedentary workers will help reduce tension and stress, reduce the number of sick days taken by employees, and will lead to a more productive and energetic workforce. In the long run, exercise can be seen as a means of improving one's health and extending life. Many workplaces that have recognized the importance of exercise in promoting a healthy workplace now have a small gym, a basketball court, or jogging or walking path available for workers to use during lunch or before or after work. This is another area where a small investment can pay a big dividend. Another area where employers and their workforce can promote healthier employees is through advocating frequent hand washing. Perhaps the most important thing we can do to prevent the spread of infectious disease is washing our hands. Diseases are infrequently spread in the air, especially over a great distance. Most diseases are spread via direct contact. Touching a germy object or shaking hands with a sick person is a common path for colds and other infections to spread. Washing hands before meals, when handling objects in a public place, or after using the bathroom, and after contact with a sick person will dramatically reduce the spread of diseases from the common cold to flu to even SARS. It is important that everyone in organizations get medical checkups. Hopefully, every employee has regular checkups from a doctor or a nurse practitioner. Some poor employees may not be able to afford health care, so checkups from a nurse in the workplace may be a wise expenditure of company funds. Screenings can catch cancer, diabetes, high blood pressure, heart disease, infections, and injuries. Catching these problems early before they become disabling is good for business and good for our employees. Many people, especially men, fail to get regular checkups. Our organizations should also develop safety plans. Every workplace should have a safety plan to protect workers against natural disasters such as fires, earthquakes, storms, and human turmoil from workplace violence, war, and terrorism. Recent events from Indonesia to the United States, from Colombia to Spain, suggest no country is immune from the scourge of terrorism. Some terrorist activity can be prevented, and providing workplace security and training employees to report suspicious activity can prevent some episodes of terrorism. And every workplace should have a disaster plan